Hello, if we haven't met, my name is Stephanie Coleman. I'm the Physician and Patient Relations Supervisor at Collins Vision. I'm here today with our physician team to talk about some protocols we've adopted in the last few weeks so that we can be a resource to you during these strange times. Dr. Michael Collins will go first. He'll be discussing our robust safety measures in detail. Dr. Nicole Alessi will be coming on after that, and she'll be discussing how we successfully incorporated telehealth into our practice. And we'll end with Dr. Rosen, who has some great additional resources and pro tips for finding PPE and other materials for you. Let's get started with Dr. Collins. Dr. Collins, take it away.
Thanks, Steph. Good morning, everybody. Thanks for listening in. And I know we're recording this, so you can see it whenever you want. If you have any questions, please don't hesitate to give us a shout. We'll be happy to answer those. So we're going to be going over our COVID-19 safety protocols for our staff and our patients. As you all know, we are living in a brand new world right now, especially in healthcare. So when we reopened, we wanted to make sure that we did everything possible to protect our patients and our staff. So these are the things that we're doing. So staff safety measures. Upon entry, everybody washes their hands, just like they should probably have always done, but we're making sure that they do it now. We take their temperature, we log any symptoms that they have along with the temperature. The physicians do the same thing. We all wear a mask at all times while we're in the building, especially during patient interaction. Obviously, if you're eating or something like that and you're social distancing, you don't have to wear a mask at that time. So for the doctors, we're wearing the N95 or the KN95 masks. One thing I noticed when I first started using this is that we got some steam coming up over our nose into the oculars. So I've been taping that part. And there's different things that you can do, but that's really helped me. And sometimes I hold my breath while I'm doing the exam and I talk afterwards. That helps as well. If we have any, if we're doing any procedures, anything like that, we put gloves on. Obviously, we wash our hands before and afterwards. Any support staff that also has direct contact with the patients will be using the N95 or K95 masks. Once again, gloves if they're touching the patient. And we found that you can use hand sanitizer over the gloves again if you're comfortable with that. We have some staff that don't have a lot of interaction or no interaction with the patients, and they're just using 3-ply surgical masks or cloth masks while they're in the office. We've encouraged all of our staff to practice social distancing, just like we're doing at home and we're doing out and about. We're limiting time in the break room. We're having them eat in their cars if possible. I know it's a little bit awkward, but during these times, it's the safest thing to do. We used to have big meetings in the break room. We're not doing that anymore. Only 4 people are allowed to go in there at the same time. The patients are watching everything that we're doing. So even when we're not with them, they may be looking out of the corner of their eye. So we're disinfecting everything. And really, we're doing that for our safety and their safety. So let's go over some patient safety measures. When a patient calls in now, we're doing things a little bit different. We're trying to get as much information over the phone as possible. So we'll ask screening questions, make sure they haven't been around anyone that's been diagnosed with COVID-19, make sure they haven't been around with anyone with symptoms or fever. We gather all the information we can from them before they come in. We scan and copy all their insurance information so they can send it by email. If they have any optical needs, we set that up beforehand to make sure that that's ready for them. We also review the patient's balance for their visit, and if they want to pay over the phone before they come in, that's great. So anything that we can do to minimize the interaction time while they're in the office is what we're after here. So upon arrival, it's not quite the warm, fuzzy feeling that you used to get when you entered Collins Vision. Now we have someone outside, a nice person, and it's still trying to make it as warm and fuzzy as possible, but it's a little bit different. So when the patients come up to our office, they're greeted. They can use the hand sanitizer dispenser that you see right there. We go over any questions that they may have. We ask them screening questions. We get their text, their phone number, so we can text them when they're ready for their appointment. So now they're actually waiting in their cars for their appointment. And honestly, our patients are used to this now. At first, we thought this would be a big impediment, but when they're going to other doctors' offices and doing other things, they're kind of used to waiting in their car at this point. So they're waiting in the car. We can send them a text, say it's time to come in. We only allow essential caregivers and translators to be with them now. We used to encourage patients to bring spouses and have another pair of ears and eyes there, but for obvious reasons, we're trying to minimize traffic through the practice. So if possible, no one comes with them, but if they need a translator or an essential caregiver, then obviously they're allowed to come or service them. So upon entry, once they come into the building, they're greeted by one of our technicians. Once again, they're asked to use the hand sanitizer. A lot of our patients have masks, so that they can continue to use these masks during their visit. They don't have a mask, we give them a mask to put on. Some patients come in with gloves. Obviously, those gloves have been touching all kinds of things outside of the office, so we have them remove those gloves and put on a fresh pair of gloves. Our patients are then taken back to be worked up. As you can see here, we have these new plexiglass sneeze barriers. These are installed both at our check and checkout locations. As you saw at the very beginning, right, we also have these touchless hand sanitizers throughout the office. We're looking into touchless soap dispensers and touchless towel dispensers as well. One thing that's real important to the patients, and we used to do this to a lesser degree, but now we're wiping everything down right in front of the patient. So they know that when they come into the exam room, everything is completely sanitized right in front of them. They see that we have these new slit lamp safety shields as well. After the patient's been worked up, they'll be placed in a lane to see the doctor. We try to minimize the use of the waiting room. You can see our waiting room is not quite what it used to be. Instead of having people gathered around in nice little areas, they're spread out throughout the waiting area. Once again, we want to minimize the use of the waiting area. So all the chairs are put about 6 feet apart from each other. We're no longer doing our coffee service, no fresh baked cookies anymore, unfortunately. We couldn't give them water if they need it. Not quite the warm feeling that we used to have, but we're learning to deal with the new situation. So if a patient needs to see a counselor and they're available, they can go directly in to see the counselor. However, if they're not ready, if the counselor is not available, then we'll schedule a Zoom call with them, or they schedule a time for them to come in at a later time so that they can go directly to see the counselor, and once again, to minimize time in the waiting area. At our checkout, we use our tab checkout options, credit card terminals, once again, trying to minimize the interaction. This patient, just give the patient the ability to insert their own credit card. They can do all the prompts. We sanitize the terminal in front of the patient before each use. And upon leaving, they go out the service door so that there's only one entry point and only one exit point. So these are some of the things that we're doing, and I think Dr. Alessi is going to take over from here.
Thank you, Dr. Collins. I can honestly say I've seen all these protocols in action, and I know our staff and patients really appreciate the extra precautions we're taking to keep everyone safe. Dr. Collins, have you been hearing positive feedback?
I've been hearing very positive feedback. A lot of these patients are really happy to be out and about now. They're happy that they can go see their doctors again and be taken care of. Vision is extremely important. We're a little bit biased towards that. But the patients have been very accepting of the new protocols. They're just happy that they can be seen by their doctors, and they feel very safe in the environment that we've made for them.
Now let's talk about telehealth with Dr. Alessi. Dr. Alessi, you're up.
Hi. Telehealth, telemedicine is a buzzword that we're hearing a lot these days. And I think it's a really important thing to bring to our patients and offer so that they can have continued access to care. So we've successfully implemented this. It was a little bit of a rush to a start, like many practices. We limited patient flow pretty quickly, but we really didn't want to limit the access to care. So what we've learned, we're going to share with you. The first thing you want to do is really establish your team. And this starts from the moment the patient reaches out to the office with your scheduler, your point of first contact, communications with the provider, and having a billing team member that understands the nuances of billing. And we'll get into that a little bit. And I do want to preface this by saying we are absolutely available to answer questions. Our billing manager is also happy to help you go through establishing these protocols. So preparing for this, the most important thing to do is select a platform. a lot of us are on electronic medical records these days. Many of these companies are updating with telehealth options. So you can talk to your electronic record system, see if that's an option for you. As a lot of the standards have been relaxed in this uncertain time, we're now able to use things like FaceTime, Zoom meetings, DocSeeMe, or if your EMR offers a template. So you're gonna start by deciding what you're going to use, offering these things to the patients, and then specifically identifying what you're comfortable treating and communicating that with your scheduler so they can help triage and get the right things on your schedule. Documentation is going to be very important. It's going to lead our billing and make sure that that communication is stable through all patients and the office. So starting with talking to the patient, you want to get consent and document that with each patient verbally. When they come into the office at a later time, you can look at getting a consent form signed. Additionally, you're going to want your insurance or billing manager to understand the nuances of the co-insurances and whether or not they're going to restart co-pays. Getting the word out about telehealth is the most important part. The restrictions have been relaxed, but we do want to keep them as much as possible as they may start to implement them again. Advertise on your practice's website, utilize your portal, social media, and email blasting. And I think the most important part is communicating with the patients when they call, making sure that your first point of contact lets them know that this is an option for them. So if they're not comfortable or they just have a question, this is an excellent way to utilize telehealth to communicate with your patients. Our flow in the office starts with the front desk. When they have a patient who's interested in telehealth, they get the information immediately to the scribe. Our scribes call the patients, triage the patients, look into the date of their last appointment for billing purposes. 7 days prior, we want to know that before we try to submit for reimbursement. The scribe will also discuss with the patient how they'd be most comfortable communicating. Do they prefer a phone call? Do they prefer an audio-video conference with the doctor? And if so, what platform? So that we can get the patient in to see the doctor. Once the patient sees the doctor, if we're able to do a full examination, meaning examine ocular structures, mental health status, then we can go on to bill a 9-2 code, and that allows maximal billing in these cases. However, if there are issues with the audiovisual, not a good connection, or the patient chooses phone services, there are other codes. This flow chart will really walk you through the best way to bill for these visits. This is also a link, and it's a link to significantly more information as far as the billing and what's allowed right now.
Telehealth is such an amazing tool, and even when this season passes, I think people will still enjoy its convenience. Dr. Alessi, do you think we'll continue to offer these services?
I absolutely do. Our patients are so grateful to be able to reach out to the doctor to get their questions answered and to increase their level of comfort that I can't see it going away. It's a wonderful service to offer to our patients.
Excellent. Now let's talk to Dr. Rosen about great resources for finding supplies. Dr. Rosen, it's your turn.
Hi, my friends. How's everybody doing? Actually, one of the biggest challenges we've had is actually getting the resources. It's nice to know what to do, but how do you get what you need to do what you need to do? So actually, we want to offer ourselves as a place to actually, you can call us, we can help you arrange things for you, get things for you. I want to give you some information about where to get things. One of the biggest challenges was disinfectants. Disinfectants were actually, what we typically use with the cavi wipes, but they have been a challenge to get them. So we've actually made some contact with some local suppliers in the area. There's a company called XL Supplies located on Metro Parkway. And we started using something called BioEsk, which is actually it comes in gallon jugs, and it's a concentrate, and we actually mix it. Has a 4-minute kill time as opposed to the cavi wipes, so it had a 3-minute kill time, but it's actually been working out very well, putting them in spray bottles and using them. You might also, we have on the slide there, there's a website to check if a disinfectant is approved for use through the EPA. I advise you, whatever you're using, to just make sure you get on there, check the chemical composition, whatever you're using, and make sure it's okay with the EPA to use that as a disinfectant. Another thing is we've been putting slit lamp breath shields, as Dr. Collins mentioned, on everything. And again, there's a resource listed there. It's called chinrestpapersource.com. They currently do have them in stock. We checked as of last night. So they are available to you. Masks have been a little bit of a challenge also. I think a lot of you have actually mentioned that to me over time. We've spoken over the last month. Masks, the KN95 masks that we're using, we have a resource for them right now, and also the surgical masks. If you're having a difficulty getting them, you can call our office and we can try to make some, make a contact or even get them for you, and at our cost. We're also been using non-contact thermometers. There's one by iHealth that we've been using fairly regularly, and we're going to give you a link to Amazon.com where those where you can get those thermometers. I checked last night. They're back ordered for like a week right now, but they said they'll be shipping them in to the end of the month. Another thing everyone's been asking about is getting FDA-approved testing kits for the antibody. So, and we actually have some on order. We're waiting for those, and we can actually try to arrange for those. Again, you can get them through us, and I'm not sure what the cost is, but we'll update that as we know what's going on with that. And the last thing is the hand purification station and touchless soap dispensers and towel dispensers being installed around the office and currently installing around the office. Again, there's a company called UniFirst. Have the local contact listed there as Ken McClay, and there's a phone number there. You can call him and they arrange for that if you need that in your office at this point.
Thank you, Dr. Rosen. I know we especially love using local resources when we can to help support our community. Dr. Rosen, any last tips for our optometric community?
Our biggest tip is just use us. We're there to help you. I mean, it's a challenge for all of us. We're all of this together. So it's like, just call us if you need us help or have any questions about anything. And, stay safe and stay healthy.
Well, that's all we have for you guys today. Thank you, Dr. Collins, Dr. Alessi, and Dr. Rosen, and thank you for watching. We hope that you find this helpful. All of the resources we've gone over today will be included in the email that we have sent along with this video. If you have any questions or concerns, please do not hesitate to reach out. My contact information will also be sent out to you.